ICD-10 was developed by WHO World Health Organization. ICD-10 clinical modifications was developed by NCHS National Center for Health Statistics and CMS Center for Medicare and Medicaid Services. Subjective evidence sign, edge fever, objective evidence symptom, edge abdomen pain. ICD-10 codes are based on reason for visit. ICD-10 has two volumes. Volume 1 Tabular List, Volume 2 Index List. Tabular List is based on body system and structural format of the code. Index list is based on alphabetical order. This is subdivided into four parts: A. Index to diseases, B. Table of neoplasm, C. Table of drugs and chemicals, D. Index to external causes. 21 chapters and their alphabetic series. A. B. Diseases of infections and parasitic organisms, C. Disease related to neoplasm, D. Diseases of blood forming organs, E. Endocrine disorders, F. Mental behavioral disorders, G. Disease related to nervous system, eyes and ear, I. Circulatory disorders, G. Respiratory disorders, K. Digestive disorders, L. Skin or subcutaneous tissue disorders, M. Musculoskeletal disorders, N. Genitourinary disorders, O. Pregnancy related conditions, P. Newborn related conditions, Q. Congenital by birth disorders, R. Signs, symptoms, S. Acute fractures, T. Complications, burns, poisoning, adverse effect codes. Unocodes, VOX, external causes, Z. Status codes. Format and structure. Code always starts with an alphabet. Code contains minimum 3 and maximum 7 characters. 1 minus 3 characters, category 4 minus 6 characters, subcategory code, category S. Decimal point fever, subcategory X cystitis, and 3090 and 30 category. 90 subcategory ICD-10 uses an indented format for easy reference. Category A. Subcategory subcategory X. Adenoiditis category with tonsillitis, J35. 3 subcategory acute, J03. 90 subcategory recurrent, J03. 91 subcategory specified organism, J03. 80 subcategory. The codes in same indented format can be coded together. If subcategory and subcategory codes are to be given, then go for subcategory code, which is more specific. ICD-10 conventions are used in both tabular list and index list. Four types of conventions are used in ICD-10 to provide guidance to the coder. Instructional notes code first, use additional code also code first, underlying cause code, if applicable, punctuation, say brackets, parenthesis, colon, related terms A and D, WIT, each cross references, CC also, C condition, C category. Punctuations, brackets are used in tabular lists to enclose synonyms, alternate codes, index lists to identify manifestation codes, parenthesis used in tabular and index list to enclose supplementary words, which does not affect the code number. Colon is used in tabular list after as incomplete term in EC, not elsewhere. Classified other specified physician documentation was clear for the condition, but the code was not available for that condition in the coding set. At that time, code the condition with other specified. X diabetic hyperlipidemia. NOS not otherwise specified and specified physician documentation was not clear for the condition, but the code availability was clear in the coding set. At that time, code the condition with unspecified. X bronchitis, J40. Excludes one, don't code excludes, and excludes one code together. Two conditions can't occur together. Code from excludes one, excludes two, code excludes. Excludes two, code together. Both conditions can occur together. Code from excludes. Two notes placeholder X. If digits are not available, then place X. Poisoning, adverse effects codes. If seventh character is available and at the same time sixth character is not available, then place X in the sixth character. Etiology followed by manifestation. Etiology, cause of the disease sequence. First, manifestation, due to the disease condition sequence. Second, X diabetic nephropathy etiology. Manifestation, default codes, code list adjacent to the main term unspecified. If there is no mentioning of acute, chronic, or what type it is, so code from an OS. Symbols, fourth digit code requires additional fourth character. Digit code requires additional fifth character. Digit code requires additional sixth character. 7-digit code requires additional seventh character. Digit code requires additional X character. New code, new for the current year. Revised code, revised for the current year. General coding guidelines. To search a code, see first index followed by tabular. Always code up to the highest level of specificity. Signs or symptoms, patient admitted with a sign symptom and no definitive diagnosis at the time of discharge, then code only sign symptom. Pete, admitted with a sign symptom that is an integral part of the definitive diagnosis, then code only condition. Pete, Admitted with a sign symptom at the time of discharge, physician established a condition unrelated to sign symptom, then code condition, followed by sign symptom. Multiple code for a single condition if a condition has multiple codes. For sequencing, follow the instructional notes carefully. Discrepancy multiple coding egg alcoholic gastritis F10. 20 due to chronic alcoholism K29. 20 manifestation mandatory multiple coding. Age amyloid HEST E85. 4I43. Don't code value the inside of brackets or principal diagnosis. Acute and chronic conditions. Acute, sudden onset of a condition. Chronic, long standing condition if acute and chronic was documented. Then sequence first acute followed by chronic. Each acute and chronic appendicitis. K3580. K36 each acute and chronic canaliculitis. Each 04339. Each 04420. 9 here code only each 04429 chronic. Don't code acute each 04330. 9 because chronic is the sub-term for acute canaliculitis, impending, threatened condition if a PET. Encountered with a symptom, physician suspecting a condition, but at the time of discharge he confirmed the condition. Then code only the condition. If he's still suspecting a condition as impending threatened at the time of discharge, see first the subterm under impending if exists then. Code that if subterm is not existing, then code reason for visit. Borderline if physician documented a condition as borderline at the time of discharge. See the condition under borderline if exists, code as appropriate if not. Code the condition as confirmed diagnosis late effect. The occurrence of a condition from a terminated previous illness. No time period for late effects while coding late effects. Code first the current condition followed by sequela code for CVA related late effects. Then you will get a combination code from I69 category. Keywords to identify late effects due to old previous illness injury following old previous illness injury late old non-union keloid egg. Paralysis of leg due to old poliomyelitis G8310 B91. Combination code. A combination code may be possible between two diagnoses, A diagnosis manifestation, A diagnosis with its complication, A between two diagnoses, 1 nausea, 2 anxiety vomiting R112, depression F41, 8 with manifestation, 1 diabetic hyperglycemia laterality. It distinguish where the condition was exactly happened right 1 left 2. Bilateral 3 unspecified 0 divided by 9. BMI body mass index code BMI. If BMI 40, if physician has documented obesity, morbid obesity, then code BMI separately. Uncertain terminology, probable rule out, still suspecting the condition, ruled out condition. Is no more questionable, suspected, may be inconsistent within OP. Code only confirmed conditions, egg office visit, EDE or clinic and IP. Code uncertain diagnosis if still present at the time of discharge except egg HIV, influenza, Zika virus. Examples diabetic retinopathy, stones in kidney, menorrhea, cystitis, HIV, sepsis, hemiplegia, otitis media, HT, and acute kidney failure, acute respiratory failure, dyslipidemia, coma, acute and chronic appendicitis, acute chronic cervicitis, diabetic CKD mixed, hyperlipidemia, secondary hypothyroidism, fracture, love femur, osteoarthritis of hip, admitted with severe generalized abdominal pain. The physician diffuses diagnostic statement on discharge as abdominal pain, probably due acute gastritis K29. 0 PT is seen in the OP clinic with fatigue. The physician's diagnostic statement is possible viral syndrome R5380. 3. CHAPTER SPECIFICG, UIDELINES infections and parasitic diseases. HIV human immunodeficiency virus symptomatic B20 AIDS. HIV related illness and HIV infections asymptomatic Z21 HIVs. Known HIV test positive code only confirmed cases in OP and IP effect. Is converted from asymptomatic to symptomatic, then coded as symptomatic if P is admitted with HIV related illness, then sequence first symptomatic HIV followed by condition. Reason for visit is unrelated to HIV, then sequence first the current condition followed by symptomatic HIV. Inconclusive serological test or 7-5 results are unable to predict HIV up to 18 months of newborn. By default, it is R75PT with inconclusive serological test, but no definitive diagnosis or manifestation, then code R75 symptomatic HIV infection B20 asymptomatic HIV known HIVZ21 inconclusive HIV serology R75 screening for HIVZ11. For HIV counseling code Z71, 7 test results if PT return to inform Z71. 7 RFV HIV related conditions. Then code first B20 related condition RFV unrelated to HIV. Then code first unrelated condition the B20Z21 or FV fractures. Then code first fractures for B20Z21 during pregnancy. Childbirth patient admitted with HIV related condition. Then code first HIV complicating pregnancy on 987 cell B20Z21. Infectious agents as the cause of diseases B95 B97 pneumonia due to E. coli J155 UTI due to E. coli N390 B96 20 chronic gonococcal cystitis A54 on E. coli infection A49 8 if organism is involved in causing of a disease other than first chapter. Code from B95 B97 if organism is a part of the condition. Always the main term supersedes by the subterm then code only the condition B95 B97 is used only along with CZ. Series MRSA methicillin resistant staphylococcus aureus MSSA methicillin susceptible staphylococcus aureus. Colonization carriage MSSA MRSA is present on in the body without necessarily causing illness. Sepsis, severe sepsis, sepshoptic sepsis, septicemia code by default A41. 9 code for sepsis and OS sepsis with organ dysfunction AOF, acute organ failure COF, chronic organ failure AOF related to sepsis. Then code severe sepsis COF with sepsis, then code sepsis. And COF if AOF is not related to sepsis, then don't code from severe sepsis code. Severe sepsis minimum 2 codes is required. Code first organism followed by severe sepsis septicemia. Severe sepsis of if any septic shock septicemia. Severe sepsis with septic shock. Multiple organ dysfunction if any. Sepsis and severe sepsis with localized infection if a PET is admitted with pneumonia and cellulitis localized infection and sepsis. Then sequence first sepsis followed by pneumonia. If a PT is admitted with pneumonia after the admission he develops sepsis then sequence. First pneumonia followed by sepsis. Post-procedural sepsis code first complication followed by septicemia T814. Septicemia sepsis post-procedural sepsis first complication followed by sepsis and next severe sepsis. T814. Sepsis septicemia, severe sepsis post-procedural septic shock complication, septicemia, post-procedural septic shock T81. 12 sepsis and severe sepsis with a non-infectious process. In some cases, a non-infectious condition such as trauma-borne serious injury may leads to an infection which result in severe sepsis R65, 20 severe sepsis R65, 20. One septic shock should never be coded as principal diagnosis. NOTES septicemia organism that causing infection sepsis. The presence of septicemia in blood that causes infection. SIRS systemic inflammatory response syndrome, severe sepsis advanced stage of sepsis with acute organ dysfunction septic shock. Circulatory failure associated with severe sepsis and acute organ dysfunction post procedural sepsis complication that resulted after any procedure surgery resulted in sepsis A41, 9 severe sepsis A41, 9 R65, 20. Of if any septic shock A41, 9 R65, 21. Of if any post procedural sepsis T8149. A419 post-procedural severe sepsis T81 49 I41 9R65 20 post-procedural septic shock T81 49 I41 9081 12 X1 at T was admitted with its related kyphosis sarcoma of the skin B20 C4602. Up was admitted with severe sepsis due to MRSA with septic shock and acute respiratory failure with hypoxia A412 or 6521 Jai 96 on 3. It was initially admitted and treated for an abscess of the liver during the stage the PET developed a hospital acquired bacterial pneumonia A064 J159 Y95 nosocomial condition originating in hospital positive HIV test in a PET who is asymptomatic and has a high risk lifestyle. For each IV infection Z21, Z72, IT9 behavior, self damage, life. Chapter 2 and EOPLASMS neoplasm formation mass group of tissue of non-cancerous tissue benign mass of cancerous tissue but can't move carcinoma in situ mass of cancerous tissue moves one place to another malignant from primary to secondary metastatic primary metastasis secondary notes if physician documented only one organ site if it is not a default secondary site. then coded as primary site X from liver prim to pancreas sec kidney prim towards esophagus sec metastasis of kidney sec metastasis from liver prim metastatic to kidney sec if physician documented only one organ site. If it is a default secondary site, then coded as secondary X metastatic liver sec cancer. Default secondary sites brain, spinal cord, meninges, media, sternum, heart, pleura, lymph nodes, bone, peritoneum, retroperitoneum, liver, diaphragm. Sites classified to C7-6 category if two organs are involved in metastatic, then code both as secondary X metastatic kidney sec and pancreas sec. Sequencing of neoplasms based on documentation if encounters with primary site cancer, it was spread to secondary site. Sequence first primary cancer followed by secondary cancer. If a PT admitted with malignant neoplasm of secondary site that was spread from primary site, sequence first secondary site followed by primary site based on treatment if a PT is admitted with primary site malignant neoplasm and that was spread to secondary site. If treatment was provided towards secondary site, sequence first secondary site so primary site if treatment is provided for primary site, sequence first primary sites or secondary site. If no treatment is documented, sequence as per documentation. Episode of care if it was admitted with malignant neoplasm of an organ site. During the encounter, treatment was provided, then code only neoplastic disease and the procedures from CPT. Complication due to neoplasm if a T is admitted with any complication due to neoplasm. Sequence first complication neoplasms except anemia cases if a PET is admitted with dehydration due to neoplasm. Sequence first dehydration neoplasm if a T is admitted with anemia due to neoplasm. Though treatment is provided towards anemia, sequence first neoplasm, anemia if of T is admitted with anemia due to chemotherapy, sequence first anemia, adverse effect of chemotherapy, malignant neoplasm associated with transplanted organ. Sequence first complication of transplanted organ T series, 7 neoplasm code C80, 2C80, 2 neoplasm to transplanted organ, neoplasm related pain if a T is admitted for pain management due to neoplastic disease. Sequence first neoplasm related pain JG9. 3 Phi neoplasm FFT is admitted for neoplasm and developed pain. Then sequence first neoplasm related pain G89. 3 chemotherapy, radiation therapy, immunotherapy if obtained. Came for chemotherapy, then sequence first chemotherapy for neoplasm if T receives more than one of these therapies during the same admission. More than one of these codes may be assigned at a time. In any sequence FT, encountered with any complication due to chemotherapy, then sequence first complication adverse effect of chemotherapy if a T admitted for chemotherapy, radiation therapy and develops complications. Then sequence first encounter for chemotherapy F complication. Pathological fractures due to neoplasms when an encounter is for a pathological fracture due to a neoplasm and the focus of treatment is the fracture, then sequence first pathological fracture, neoplasm. If the focus of treatment is the neoplasm with an associated pathological fracture, then sequence first neoplasm. First pathological fracture neoplasm in pregnant patient when a pregnant woman has a malignant neoplasm. Then sequence first malignant neoplasm of complicating pregnancy or nigh followed by type of neoplasm. Primary neoplasm previously excised, primary site was previously excised and no treatment regarding the primary site. Coded as a history code admitted for chemoradiation immunotherapy chemos, 10 plus 20 based on treatment or documentation chemos, 20 plus 10 based on treatment or documentation chemo ZOT Psi X 10 primary site totally eradicate chemo Z 20 Psi X 10. Fex family history of neoplasm is present contagious site overlapping site primary malignant neoplasm that overlaps two or more contagious sites should be classified to subcategory overlapping for multiple neoplasms of the same site that are not contagious such as tumors in different quadrants of the same breast, code for each site. X1. Metastatic carcinoma of right lung C3491. C799 unspecified secondary site 2. Metastatic carcinoma of brain C7931. C80. 1 unspecified primary site 3. Metastatic carcinoma from prostate to pelvic bone, previous prostatectomy, with no recurrence at primary site Z8540. 6. History of prostate cancer 4. Metastatic carcinoma of brain and lung C7931, C780, C80 on 5. Up T is admitted with abdominal pain CT and MRI of the abdomen reveals a malignant neoplasm to the head of pancreas with metastatic disease to peritoneal cavity OC250, C786, Chapter 4. Endocrine disorders diabetes mellitus E08E13 pancreas secretes two hormones insulin converts glucose to glycogen. Glucagon converts glycogen to glucose E08 due to underlying conditions E09. Chemical induced E10 type 1DM E11 type 2DM E13 complications or infections type 1 juvenile diabetes by birth by default. Code type 2 DM E08 E09 E13 secondary diabetes codes identifies type of diabetes body system involved complication affecting the body system if type of diabetes not documented by the physician by default coded as Ti except diabetes ketoacidosis. Chapter 5 Circulatory System MYOCARDILIFARCTIO in acute MI 0-20. 8 days chronic MI aftercare old MI hexiled initial visit of MI. The first occurrence of attack is coded as initial. Every visit to EDER is coded as an initial visit. Subsequent visit, if MI has occurred again within the 4 weeks of time, then only it is coded as subsequent. STEMISTELEVATEDYOCARDIALINFARCTION. Elevation of ST wave is STEMI. There is a differentiation of walls in occurrence of MI anterior, posterior, inferior walls. STEMI has converted to an O in STEMI and vice versa, and then code only STEMI and STEMI non-ST elevated MI. No differentiation of walls, by default only an STEMI code. CAD and ANGINA. There is a combination code for CAD and angina. No any relation to be mentioned by physician between CAD and angina. We can code directly a combination code. Only if physician states that CAD is unrelated to ANGINA then code separately. Each YPERTE and SIO and only a code for benign, malignant, unspecified each TNI. I10. No need any cause and effect relationship for each TN with heart disease I50. I51. Series CKD. There is a separate code for elevated BP. There is a separate code for each TNC or ISIS, each TNURGENCY, and both HTN and HYPERTENSIVEC or ISISURGENCY can be coded. Each TN with cerebrovascular disease, then sequence first cerebrovascular disease followed by each TN. Each TN with RETI and OPATHY sequence is based on the first treatment disease. Chronic kidney disease if both ACUTE or E and ILF, AIU or E and CKD are present then sequence. First A or F followed by CKD. Always code highest stage. Patient's admission is for DIILYSIS. So sequence CKD first followed by DIALYSIS. Patient completed transplantation of kidney and came for dialysis. Then code first CKD followed by DIALYSIS then transplantation code. Poisoning, adverse effect, underdosing poisoning is coded when patient takes prescribed drug or unprescribed drug, overdose of a drug along with alcohol, wrongly prescribed drug, sequence first poisoning code followed by condition aroused from poisoning. EX generalized convulsions due to accidental Darwin overdose T39, 8X1A, R569. Adverse effect condition caused by a drug other substance when used correctly. Sequence first condition followed by adverse effect code. EX allergic dermatitis due to slow acting insulin L270 T38. 3x5A underdosing condition caused by the use of drug in less quantity than prescribed by physician. Sequence first condition followed by code for underdose of drug. Respiratory system if the reason for visit is for RESPIRAT or RYFAILURE, then sequence first RESPIRAT or RYFAILURE followed by other conditions. If reason for visit is for other condition, then code the condition followed by RESPIRAT or YFAILURE. If the reason for visit is for RESPIRAT or RYFAILURE and treatment was provided for RESPIRAT or RYFAILURE. But if any chapter specific guideline SEPSIS or BSTE or ICC or MPLICATIONS is proceeding, then sequence it first followed by RESPIRAT or RYFILURE. Ventilator associated pneumonia J95 850. 1. If a patient is admitted for ventilator associated pneumonia and developed pneumonia, then code only ventilator associated pneumonia and additional code to identify the type of organism. If a patient is admitted for pneumonia and later developed ventilator associated pneumonia, then sequence first pneumonia followed by ventilator associated pneumonia organism code. Physician must document specifically as ventilator associated pneumonia. If patient has pneumonia is on mechanical ventilator, but physician doesn't specify it as ventilator associated pneumonia, then don't code ventilator associated pneumonia. MENTILBE or if both use and abuse is mentioned, then code only abuse. If both abuse and dependence are documented, then code only dependence. If both use and dependence are documented, then code only dependence. If use, abuse, and dependence are documented, then code only dependence. Glaucoma code identifies the type of glaucoma affected eye glaucoma stage. If no stage is specified, then code as UNSPECIFIED stage. If the stage was unable to be determined, then code as UNSTAGE, ABLEINDTE or MINE, DSTAGE. If patient came for a glaucoma stage and is processed to another stage during the stay, then code the highest stage. There is a specific code upon the laterality eye, left, right, bilateral. P or ESSU or EULCE or pressure, ulcer decubitus, ulcer sore. ULCE or CHRONICULCER. PRESSU or EULCER is different conditions. If no stage is specified, then code it as UNSPECIFIED stage. If the stage was unable to be determined, then code as UNSTAGEABLEINDETE or MINE. DSTAGE. Deep tissue injury not due to trauma will be coded as pressure ulcer. Code as many codes as from L89 for different sites specified. If different stages at same site, then code the highest stage. If a patient is hospitalized with one stage and progressed to another stage, then code the admitted stage and the highest stage it is progressed. X patient with stage 1 and progressed to stage 5, and on discharge it is diagnosed to stage 3. Code stage on admitted stage and stage 5. PRESSU or EULCE or pressure, ulcer decubitus, ulcer sore. ULCE or CHRONICULCER. PRESSU or EULCER is different conditions. If no stage is specified, then code it as UNSPECIFIED stage. If the stage was unable to be determined, then code as UNSTAGEABLEINDETE or MINE. DSTAGE. Deep tissue injury not due to trauma will be coded as pressure ulcer. Code as many codes as from L89 for different sites specified. If different stages at same site, then code the highest stage. If a patient is hospitalized with one stage and progressed to another stage, then code the admitted stage and the highest stage it is progressed. X patient with stage 1 and progressed to stage 5, and on discharge it is diagnosed to stage 3. Code stage on admitted stage and stage 5 1. Head neck 9% 2. Each arm 9% 3. Each leg 9% 4. Anterior trunk 18%, posterior trunk 18%, genitalia 1%. NERV or USSYSTEMDISO or DERSPAIN pain, chronic pain syndrome, central pain syndrome. These are all different conditions. If physician documents above conditions, we can code them separately. Two codes for a chronic site: pain X chronic low back pain code low back pain and chronic pain post-operative pain associated with the operative problem, then code the complication code T series post-operative pain not associated with the operative problem, then codes the pain code only. No complication code to be coded. If the reason for visit is for pain management, then sequence first the pain code. If acute and chronic are treated, then sequence first acute followed by chronic. By default, post-operative codes are coded under acute. CVA, cerebrovascular accident, stroke are only coded in acute. Any complication due to CVA is coded as sequel of CVA from category I69. Dominant, non-dominant side for each EMIPLEGIANHEMIPRESIS. Have to check whether dominant or non-dominant. For ambidextrous patients, it is by default DOMINIENT. FRACTURES by default of fracture is coded as closed fracture. There is no separate code for dislocation. AMPUTATION by default and amputation is coded as complete. PREG and ANCYOBSTET or ICSI and CIDE and TALP or EG and ANC YZ33 on a patient is admitted for a condition other than pregnancy, which is not affecting the pregnancy. It is called INCIDE and TILP or EG and ANCY. Z33. One will never be coded along with O category codes. It will be coded as secondary diagnosis. ANTITI or TUM time period from the day of conception until the date of delivery. POSTPAATUMPUE or PERIUM immediately after the delivery I, up to 6 years from delivery. PE or IPARTUM period from last month of pregnancy and 5 months from delivery. A normal pregnancy term pregnancy is of 38 to 40 weeks. Preterm pregnancy is of less than 37 weeks. Postterm pregnancy greater than 40 weeks. Prolonged pregnancy is greater than 42 weeks. First trimester 0 minus 14 weeks, second trimester 14 minus 28 weeks, third trimester 28 weeks or more. We have to code separately the gestation period Z3A category. High risk pregnancy patient O09 age less than 16 and greater than 35 previous abortions. Smoking, drinking. Advanced maternal age, i.e., age 35. Obese persons. Sequencing order: if a condition is complicating the pregnancy before delivery, code as pregnancy complicating condition. If a condition is complicating the pregnancy during delivery, code as from childbirth. Conditions like each IV, DIABETES, HTN, etc. Sequence first O category followed by conditions. Each IV complicating pregnancy. Sequence first O987 followed by 020. Diabetes complicating pregnancy. Sequence first or 24 followed by E08E13. Gestational diabetes pregnancy induced diabetes. Sequence first or 24.4.HE or E. No need of coding diabetes again. In inpatient, patient is with different trimesters at admitted discharge, then code only admit trimester. Sepsis categories complicating pregnancy. Sequence first O category followed by sepsis codes. For puerperal sepsis, sequence first O85 followed by B95, B96 followed by sepsis. Smoking alcohol complicating pregnancy. Sequence first O993. ABO or TION expulsion extraction part of the placenta without an identifiable fetus less than 20 weeks of gestational age. Ectopic pregnancy in which a fertilized ovum implants and develops outside of the uterus. Molar pregnancy in which an ovum within the uterus develops into a mole or benign tumor. Biochemical means through earliest miscarriages. Types of abortions: SPO and TAE or USAB or RTION occurs without any instrumentation or chemical intervention. TE or MIN, ATION, OFP or EG in ANCY failed attempt induction of terminating the pregnancy, has failed to evacuate or expel the fetus. Newborn neonatal 0 to 28 days immature or premature newborn at 37 weeks. Post maturity newborn 42 weeks. Low birth weight 1000 minus 2000, 499 gmims. Extreme low birth weight 500 minus 919 nanogems. If a patient having extreme low birth weight and extreme immaturity less than 28 weeks, then code them separately. Conditions affecting the newborn. Code as many codes from P series. Delivery in hospital through vagina, sequence first Z38. 0 followed by conditions. Delivered inside hospital through C-section, sequence first Z38, on followed by conditions. A newborn was transformed from hospital A to hospital B. The receiving and hospital conditions have to be coded as reason for visit. Thank you.